50 years have been dedicated by so many people. We have had great support from our community since 67, probably before that, 1965. Healthcare has evolved, and in a dramatic fashion, our growth from basically a 50-bed hospital to about 245 beds and then even beyond that. Our service area has expanded from essentially one county to about 3 to 4 counties.
We stay on the cutting edge. We anticipate the future, but we are also flexible enough as opportunities come, we just jump on. The board sets the absolute framework, and they're very intuitive. They see the day-to-day needs of this community, and they're willing to embrace those needs in any way they can to help us overcome and meet those needs. I think they have led us down a journey that has kept us just one step ahead.
Just economically, it's such an economic machine for this area. That alone is huge. But then beyond that, you take into consideration how important it is to the health of the community. You look at other smaller communities around that don't have a system like ours, they struggle mightily because of it.
I can tell you what the hospital means to this community. I mean, when you look at the physicians and how the hospital has grown, it's by far the largest employer and the largest industry. When you have a strong hospital, that brings people to your community. When we're looking at industry and other business to come in, that's one of the questions they ask because they want quality medical care.
Healthcare is important to a community. Communities that do not have that are communities that are beginning to dry up. And so it's been a blessing to this community, and the community's been a blessing to Unity Healthcare, in that we all support one another in this sense of family.
The success of the community is why we've been successful. I mean, it is because of our doctors and leadership have contributed. I mean, I can't say that hasn't played a part in our success, but it's been a community issue, I think, is why we're successful. You can look at other communities in Arkansas, and they have not been as fortunate.
As I walk around the hospital, I look at what we started with and what we have today, and it is really gratifying to know that the doctors and the JCs worked so hard, and look what we have now. We are the only hospital in the state of Arkansas affiliated with Mayo Clinic. You have to do something right to be having this kind of designation. And when I see the signs on the front as I come to work that we are part of Mayo Clinic, that we're serving hundreds of thousands of people in our area, it makes me feel good that I've lived long enough to see it.
The hospital's success is due to the leadership that we have. We have an administrative group that are very, very intelligent, very smart, and work very hard for the people.
We have just incredibly high quality people on staff. We have a great organization with great people. We have supportive doctors that you don't always have in most communities.
We've got a good medical staff, I mean, it all starts with that. You don't have good doctors, you don't have a good hospital, The doctors that practice here are supportive of Unity and live in the community and believe in what you're doing. And I think that goes a long way. And that goes back to that sense of family that I think is really important.
That's our number one goal here is quality care. Our number one goal here is to put the patient first. Everyone works hard to provide the best quality care for that patient.
I think by and large we've always had high quality doctors and high quality nurses, and we've been empathetic and caring for patients, and the satisfaction surveys have always been good. I think that's really the main reason the hospital has done well.
It is my hospital. It is my home. My daughter's a nurse. My daughter works at Unity Health. Who would have thought that in 1987, you're going to stay here and that someday your child is going to work here? It's your home. It is absolutely your home, and that's the reason you do what you do every day.
I was the most luckiest person in the world to have worked here. It really feels great to work here for 50 years. So I'd kind of postponed my retirement so I could be a part of that. I loved the people I worked with. I loved my job.
I have worked for the last 41 years at the White County Medical Center. It has been a privilege and an honor to be a part of a hospital that I know from the administration on down is dedicated to the patient. It's just been an honor to be a part of such a program as that.
By serving on the board, I have been so impressed with the attitude of service. I think that we all work together as a whole to make sure that each person is represented, given quality health care, and also met, like we say, with dignity and respect.
We have happy people, and with happy people, you have success. And Unity Health, with the staff, with the board, with the auxiliary that I'm happy to work with, you see smiling faces everywhere you go.
It takes everyone in the community to make a medical system like this work. It takes the physicians, it takes the administrative staff, it takes the general public to support us, it takes our county government to support us, and they've all been always very supportive of our system. So without all of that working together as one, it wouldn't happen, but it does. And that's one of the nice things about living in this area.
This first 50 years, we've dedicated a lot of blood, sweat, and tears to making this the best place for our patients. Our expectation is that over the next 50 years, you make us proud, and we're even better than what we were able to achieve in these first 50 years.